Hi, this is Karine with Karine and Company. Today I had someone come in with herpes zoster, and it was up on her scalp area here. So in traditional Chinese medicine, you want to know what is that dermatome. So dermatomes either reflect the cervicals, the thoracics, or the lumbars. And then you can also have your C's and your T's. Okay, so our cervicals are up here in the neck. So if we're having it anywhere in the head, this person had it more temporal. Wouldn't matter if it was temporal, frontal, vertex. What you can do is one option is massage your neck a lot. Move this energy, move this chi. If you have any breakout here, you definitely don't want to do that. But it's important. If it's on the chest or on the back, start moving this cervical energy, okay? This is our ear. If you're getting auricular medicine, someone could prick to bleed the apex of the ear, which is this tip. But if you don't have anybody doing it, maybe what you could do is just apply pressure, pinch, release, pinch, release, pinch, release. You could do both ears. And then points that I put seeds on for her was the liver point, because the liver and gallbladder, because sometimes when life becomes too much, we feel overwhelmed, stressed, frustrated, agitated, and just we get too much on our plate. Sometimes we don't know how to get that energy out if we're not working out, if we're not walking, if we're not eating healthy, drinking healthy. That it's called the yang energy. It just keeps rising, and then what happens is it causes too much excess, whether it's excess heat, excess frustration, and then what can happen is it can break out on your skin. Anytime we have a breakout on our skin, that has to do with our lung, because our lungs are in charge of all the skin of our body. If we have any pustules or breakouts, which herpes zoster is, that's a lot of toxins in the body, it pops out and it brings blisters, which is like a dampness, a damp heat. And you can read about this and really educate yourself. It'd be TCM herpes or TCM herpes zoster, and just read the different points. But our liver channel, our gallbladder channel, kidney yin vacuity, liver yin vacuity, we need to move the chi in the blood. We need to move everything from our body. So we also did the adrenal glands on her. So again, those are on the tragus right here, and you can just lightly manipulate those. It's hard to see, but it's just this little tip. You can manipulate that. The spleen point, the liver point, and then I want to give you a couple more ideas that you can do. So in the pictures you're going to see under the chest, like right below the nipples, in the 6th intercostal space, you'll kind of know, because whether it's under the breast for women or men, you go up into the midline and you find in that intercostal space as you walk it out, where is it really tender to the touch? When it's tender to the touch, either hold your pointer finger there or your thumbs there, and pretend this is the point. Hold it like this, and you can either sweep it out to the side and just take breaths. So right here, I would just kind of walk it out, or you can just hold your hands here and apply that little bit of pressure. Take a breath in, go out a little bit more. It's not on the bone, but the bones will be tender too. But what I want you to do is make sure you massage it enough. Don't push so hard that you crack your ribs, but you've got to move the energy in between the rib cage, and it's the 6th intercostal space. I do have a picture there that comes from Deadman, and if you don't know what it is, just read the 6th intercostal space, Google it, get a bigger visual of it, find it, locate it. I guarantee if you have a lot of frustration, you're feeling overwhelmed, agitated, have a lot of stagnation or liver yang rising, those points are going to be really easy to find. Another great point you can do, I have another video on it, but you can take both your thumbs, and women, it's in between our bra on the sideline. Men, it's usually directly across from your nipples and down 1 or 2. But this is another good point. spleen 21. And you'll know because it almost takes your breath away, the spleen 21. But what it's going to do is move a lot of chi and blood. It's going to help if you have any kind of breakout on your chest, on your back, or on the face. Because those dermatomes, they're just the pathways. So you could, this side really hurts a lot. This one isn't as bad. So just manipulate again. You take a breath in, hold a count of 5, and then a slow, long exhale. So I'll do it here. And honestly, just from me starting, this pain has reduced. But I notice as I massage it a little bit more, I can feel it on the bone as well. So my goal is to really move that energy. You can even take it like this. Just be careful that you don't break your ribs or push your ribs so hard with your strength. You just want to use enough strength like this just to move the chi. You don't want to break anything. You don't want to misplace anything. You're just simply moving stagnant chi. And then there's a gallbladder place. Let's say you can't figure this out. So we have a gallbladder place right above our pupil. So if I look straight ahead, we have gallbladder 14 here. I could simply sit like this and move that out. Now this is our head. There's going to be a picture showing my toes. And it's not the largest toe or the second toe, but it's directly in between. So this point here is LI4. That's a command point for your head and your face. You can put your pressure here. It's not on this first metacarpal, but it's on the second one. And you can hold this pressure here on both sides. On your feet, it's called liver 3. And there's a picture of my feet there. There's a little circle. And it's between the first and the second metatarsal. You'll find it if you slide your finger back till it becomes to a V. Slide your finger back, and right there you'll know, because almost everyone at liver 3 has stagnation there. But what's beautiful about liver 3 is it's going to pull everything from up here and take it down. What we're trying to do is move the chi and take it down, because lots of times our breakout is through here, can be up in here, or on the back side. If you have it on your face, be careful. Herpes is really easy, especially while the pustules still have goo in them. You want to make sure that if you touch them, you wash your hands. Don't use the same washcloth twice. Don't use the same Q-tip. Make sure you do not touch your eyes. You don't want to spread it. It can spread quickly. Make sure your hands are always clean before you touch and after you apply any type of topical. Thank you. This is Karine with Karine & Company. Please like, subscribe, and forward to a friend.